Hello everybody. Today we're going to discuss about the nose bleed of children, but as it is quite a frequent thing that happens, and also it's sometimes very uh, scary, isn't it? So nosebleed is very common in children, and nosebleed, also called epistaxis, occurs when a small blood vessels that lining the of the nose that burst, and the inside of the nose is very delicate and small blood vessels are fragile close to the surface. This means they can burst very easily and starts bleeding. Bleeding is usually minimum and brief. Typically within 10 minutes it should stop. When it took, it can look like a lot of blood has been lost. It's rare for a child to lose so much blood that it can causes any problem. This is only likely to be with frequent heavy nosebleed over the weeks and months. Then it can cause problem of anemia and things like that. What are the causes? So it's very caused by harmless activities like nose picking, blowing too hard, and maybe getting knocked on nose during play, or very sensitive blood vessels that burst and bleeds in the warm dry weather, infection of the nose, throat, sinus, common cold, allergies like dust mite allergy, hay fever, a foreign body in the nose, constipation, excessive straining when doing the toilet, certain medication, anti-inflammatory medications, nose spray, underlying medical problem. Sometimes it can have multiple nosebleed over several weeks. First aid is very important. Do that not nosebleed not cause any pain. However, maybe distress or upset by this blood is coming from the nose. Try to be calm and reassure child, because crying will make it worse. So sit the child in upright positions and in a comfortable, and lean a little bit in this way forward, and squeeze in the lower part, soft part of the nose, pressing the nostril together with finger. If they old, the children can do themselves. Keep squeezing for 10 minutes. Do not keep removing and looking that whether there is bleeding continuously. So it can take time. So you can do some distraction by reading a book or things. Have a clock handy. So when 10 minutes gone, you just take. If that is stop, that bleeding is stop or not. If continues, then squeeze again another 10 minutes, and then see if in addition to squeezing the nostril, try the following. If the child can tolerate, place a cool towel in the ice pack back of the neck while sitting in the lap. Offer the child a ice sealed bowl or cold drinks to cool them down and get rid of taste of blood. Encourage him to spit out any blood that dripples from the nose in their mouth, and swallowed blood can make them to vomit, which can cause nosebleed to continue to be worsened. Now, when to see the doctor? If after trying first aid bleed it continue, then you have to take to GP, to the nearest hospital emergency department. A doctor will look nose and with a light and see if they can find the bleeding vessels. Doctor may apply cream or ointment in the nose. Use cautery, that is a chemical that burns or freezes the blood vessel that bleeding. Pack the nose with dressing and prescribe some antibody to prevent bacterial infection while packing the nose. Occasionally, you will need the nasal packing, may be admitted to hospital overnight. If packing is not needed, doctor may prescribe antibiotic ointment to apply and 4 times a day, or in this way. For severe nosebleed, need to do some blood test. So you have to take your child to GP. Nosebleed frequently over the several weeks. Have nosebleed and bruise of the skin anywhere in the body. Pale scale family's job. Bleeding disorder. Your child may be referred to the ENT or nose specialist for frequent bleeding. And care at home is absolutely very important. Rest, if after a nosebleed, rest the child for a couple of hours if nosebleed was not severe. Rest for 12 to 24 hours if there is severe nosebleed that need medical assistance. Quiet activities like drawing, reading book is better. Avoid to take that hot drinks or hot baths or showers for at least 24 hours. Tell child not to pick or blow for 24 hours. If your child nose has been packed, gauge will need to be remained for 24 to 48 hours. You will need to take to GP for checkup and gauge removal. Do not try to remove the pack yourself. It may fall out on its own. and the bleeding does not return, then no need to go back to the so so if that gauze fall out on and bleeding not return, no need to go back to emergency department or GP. To help to prevent this nosebleed in the future, child nose is very dry and cracked. Apply a petroleum based jelly like Vaseline to the nostril twice each day for a week. This can be done by cotton or fingertip, gently rubbing inside the nose. Do not use this method under 4 years of child because they will usually not cooperate with this. And if the child suffering from constipation, increase the fluid intake, fiber intake. If you may need to give them stool softener after discussing with doctors. So key point to remember is that nosebleed is very common in children and is often caused by harmless activities. Most nosebleeds caused by minor discomfort to the child. First aid is used to treat nosebleed, and for severe nosebleed, a doctor may use ointment, cauterization, nasal plaquing to stop bleeding. So hope this will help about nosebleed of children, and we will discuss another facts about children's illness in summer next week. Bye bye for today.